In dentistry, we can prescribe antibiotics for oral infections or prevention of infections, which is antibiotic cover, I suppose. And there's other things such as painkillers. So if you're doing a surgical procedure, they are going to be sore afterwards, so we can prescribe painkillers. We also can prescribe sedatives. So if you think they're going to be stressed out during an appointment, you can prescribe sedatives. Also, if people have ulcers in the mouth, you can prescribe certain corticosteroid creams and things like that for it. So those are the main ones. You can also prescribe fluoride tablets if you're in the middle of nowhere with no fluoridated water and you have a patient who you think needs more fluoride to strengthen their teeth. That's an option as well. And there's also local anaesthetic, how much local anaesthetic we can give. So if you're changing the type of local anaesthetic, there's different maximum dosages and also for different weights of people. So it's important to know how much anaesthetic you can give to someone in an appointment. I suppose when I went to university, my first year of university, we had exposure to a lot of pharmacy students. That was mainly because we shared similar classes. So I've made some friendships with some pharmacists, and I noticed as I was studying dentistry that we actually never got to prescribe because we weren't qualified. So even though we learnt about the theory of prescribing, we never did. And once we graduated, we had to start prescribing, and it was a concern to me that I don't like the idea of mental arithmetic because it's always got the risk of errors, and unlike your maths exam back in high school, if you stuff up and you just get marked down, if you're prescribing for someone and you stuff up, well, that can be quite dangerous. So in the app, it basically shows you what you have to prescribe for different weights. So if you're prescribing for someone who's 7 kilograms, an adult, versus someone who's 20 kilograms, such as a child, the dosage is significantly different. And each medication is different. So if you're prescribing amoxicillin or tetracycline, it's completely different. I had some notes. I took notes when I was at university, and I thought, well, if I just put these notes into an app, I'll do exactly what you have to write down. That means every time I prescribe, I just look at these notes. I don't need to think about it. And incorporate all the drugs that dentists are allowed to prescribe. So I thought that would be a great idea for dentists. It wasn't an idea to make money or anything. And I called up a friend of mine who's a software engineer, and he was happy to go along with it. The danger with overdosing is the patient is more likely to have adverse effects. They're more likely to end up, like say, stomach complaints, feel a bit wheezy, a bit dizzy. In many ways, you'd hope the pharmacists would pick it up, and they're pretty good, they normally do. But at the same time, from a legal point of view, the person who wrote the script is very responsible too. So if you put the decimal point in the wrong spot, if you're giving a child an adult dose, the child is very likely to get very sick. And the problem about underdosing is it becomes ineffective. If you're trying to fight an infection and there's just not enough antibiotics in there, then it's not going to do the job, and the child's still going to have that infection. It's still going to have bacteria, and then you think, well, was there really a point in prescribing in the first place if it wasn't done properly?